Hi guys, I'm back. Episode 5 of Heart to Heart with Heather. I attempted to be consistent by releasing weekly vlogs, but life got in the way. I got to episode 4, I think in December, and then, I don't know, things happened and I did not get around to continuing. So, it being a new year, I'm deciding to pick up back my passions and my ambition and my drive and do what I can. So, what has happened since my last chat? Okay, so January 26th, I I think I mentioned I'm the disabilities ministry director at my church, and I hosted a Disabilities Awareness Day on Saturday, January 26th. Regular Sabbath school programming. We interviewed two members that live with chronic pain and how chronic pain impacts their life. Sermon, and then in the afternoon we had a 2-hour workshop. I had a presenter come in from the state's suicide prevention association to talk to us about recognizing the signs and symptoms of someone who is suicidal and how to help them, to take them seriously and not think that they're just calling a bluff, and also to make others aware that people who are suicidal do not necessarily want to die. They just don't see any light at the end of the tunnel. They don't see anything to be hopeful for. And they just want the pain to stop, whatever pain it may be that they're having, whether it be physical, psychological, you name it, interpersonal. So that we did on Saturday afternoon, and then Sunday, January 27th, I hosted a chronic pain walkathon. My intention was to raise awareness of chronic pain sufferers, yes, and also to raise funds for a nationally recognized pain foundation. My primary beneficiary would have been the U.S. Pain Foundation, but they had gotten themselves in a little bit of a legal problem due to their previous CEO misappropriating funds, and so the IRS was looking into them, and their fundraising had to cease until further notice. So unfortunately, their fundraising ceased, opportunities ceased during the time when I was looking for a beneficiary. So unfortunately, they lost out, but the American Chronic Pain Association benefited as we raised $465 for them. Yahoo! Anyhow, so yeah, we raised awareness, and I continue to be very passionate about my fellow chronic pain sufferers. As I shared before, there are 50 million Americans in this country that suffer from chronic pain. And this is getting ridiculous because now the CDC actually released guidelines back in 2016 to help direct doctors as to how to treat patients with pain in the midst of this national opioid crisis. Well, the doctors misunderstood the guidelines. They turned it into law. And so pharmacists have been known to see patients show up with legitimate prescriptions, and the pharmacist decides that they're not filling the prescription because I guess they know better than the doctor. And doctors, pain management specialists included, they have also become very leery or frightened by treating pain in pain sufferers, and so they're limiting their prescriptions, and so the patients are suffering. Now, as a registered nurse, I understand the medical concerns and considerations, but as a patient, I also can empathize, and more so empathize with the patients. So we need to raise awareness of chronic pain sufferers. They need to hear, senators, congressmen, congresswomen, they need to hear the real deal. Chronic pain sufferers are not addicts looking for a high. As a chronic pain sufferer myself, I am looking for pain relief that will make me comfortable, make me be able to function in society, be able to wash my dishes, do my laundry, not be a burden to my husband, my son, my family members, or even society itself. So they say that chronic pain has not, opioids have not proven effective long term in chronic pain sufferers. Well, they never asked me anything because I've been on opioids for 12 years. I am not high, I'm not addicted, but I do need that medication to keep me functioning. If not, I will be in bed, crying, in pain, unable to relate or interact with anyone. So, guys, if you watch this video, please like this video, subscribe to the channel. Let's keep the conversation going about chronic pain. Keep it real. Love you. We will talk again soon. Again, welcome back to Heart with Heather. See you next time.